Hi, my name is Shavonda Jackson. I am a BSN nursing student from Indiana State University, and I will be doing a presentation on promoting wellness in the community, a healthy way of living. The population at risk will include families in low-income areas with limited resources. Learning objectives. At the conclusion of this presentation, participants will be able to define and explain holistic wellness, identify the importance of wellness programs, define and explain obesity, identify the risks associated with improper diets, identify the importance of oral hygiene, and identify why vaccines are necessary. There will be a pre-test before you continue with the presentation, and there will also be a post-test at the completion of the presentation. Thank you. Proper oral hygiene. Routine dental screening and cleanings are conducted every 6 months. Oral health programs on how to brush teeth properly, flossing, and regular checkups are essential. Preventing infections and dental caries will alleviate the potential for heart infection, which increases the incidence of poor oral care. Implementing health fairs and with demonstrations and resources to refer the community to a dental care facility will also help with improving dental care and help cutting down on oral diseases. Holistic approach. Holistic wellness is health in regard to mind, body, and spiritual balance in a person's life. Holistic wellness includes activities like meditation, yoga, eating healthy, and finding ways to redirect stress. Developing programs to help teach community holistic practices would help the community learn how to practice these skills to de-stress and to help with controlling risk factors such as hypertension, diabetes, obesity, but it also aids in mental stability. Vaccinations. Vaccines are given to provide immunity and protect against viruses and diseases. Childhood vaccines aid children not to acquire many of the childhood illnesses that they may contract in school. It also helps fight against HPV, which is known as human papillomavirus, which is a type of cancer. COVID vaccines are available for protection against COVID-19. This pandemic has plagued the United States, and vaccination will help with getting the population the immunity that's needed to fight against COVID-19. Diabetes. Diabetes is when there is an imbalance with the control of the glucose or insulin in our body. Hyperglycemia is the overproduction of glucose. Hypoglycemia is when the blood sugar is at a low level. The pancreas controls the blood sugar level. Uncontrolled diabetes has an effect on the vascular system, kidney, and it also impacts the vision. Hypertension. The causes of hypertension are smoking, diabetes, high cholesterol, high stress level, and these things can lead to stroke, heart attack. It may even cause kidney failure. There are different levels of hypertension. The staging starts with stage 1, which is the lowest level, which is uncomplicated, and it can be controlled before it gets to the point where you will need medicine. Stage 2 is asymptomatic, and it can result in the diabetes, it can result in the chronic kidney disease, and it can result in heart disease. At this point, medication will be needed to get it under control, and stress level needs to be minimized. Stage 3 is this hypertension is at its worst, and it's the established disease, and it causes cardiovascular disease. It also damages the organs, and it leads to stage 4 CKD, which is chronic kidney disease. It can also cause shortness of breath, weakness and dizziness. It can also cause nausea. These are signs of a heart attack. So it's also known as the silent killer because of it can go undetected. Sometimes you can be asymptomatic and you may not have any signs, but your blood pressure is extremely high. So preventing the hypertension, you can do it by exercise, avoiding fatty foods, and limiting your stress level. Weight management. Weight management can be controlled by introducing some type of fitness into our lives. That can be walking 30 minutes 3 times a day can aid in effective weight management. A change in the diet by increasing the vegetable intake and portion sizes, decreasing the amount of processed and fatty foods in our diet, and reducing the amount of stress that is brought into one's life. Doctor's visit and eye exam. Healthy living is maintaining a healthy body by routinely seeing your primary physician once a year for your annual checkup. Women seeing the gynecologist once a year. Once every 3 years, depending on your age if you're over 50. And seeing the optometrist once a year for good eye care. Community health programs provide resources for community awareness, for health fairs where they talk about blood pressure, they monitor blood pressure, they check for diabetes, they talk about healthy eating, healthy lifestyle. They share programs for financial help. They share programs to how to establish some type of healthcare insurance, or they direct or refer to programs that may have some type of aid that's government funding to see the doctor. So it's just providing a healthier way to improve our health. Mental health is important for managing our day-to-day life and remaining stable and knowing how to prioritize and de-stress when we have problems. So we don't overthink things, we don't stress out, but we find positive ways to be able to handle our stress with meditation. Exercise is a great way, and being able to talk to somebody if you have a mental health issue. So seeing a counselor or a psychiatrist, but seeking the help that we need if we have mental health problems is needed.